What are the contraindications for GLP-1 medication? That is absolute no-no for you to consider GLP-1 receptor agonist when you're having a discussion with your treating physician, as well as what you should be aware of. So number one is a personal or family history of medullary thyroid carcinoma, which we covered in answer number one, including one of the conditions which is called multiple endocrine neoplasia. And there are different types where it encompasses medullary thyroid cancer, pregnancy, right? Breastfeeding. If you already have, a lot of hypersensitivity or some reactions to GLP-1 receptor agonist in the past, that is definitely considered. Now, where do you need extra vigilance, extra caution would be if you already have a diagnosis of gastroparesis or if you already have a diagnosis of delayed gastric emptying. As an endocrinologist, I see patients when they are coming to me with really complicated, uncontrolled type 1 or type 2 diabetes mellitus, where they already have neuropathy. Many of the times they tend to have autonomic neuropathy where their nerves in the gut are affected, and that leads to slowing of their stomach peristalsis, and they have delayed gastric emptying in those scenarios. That's autonomic neuropathy. So it's very important to know what their baseline is at that particular time when you're discussing GLP-1 receptor agonist. History of pancreatitis, it's usually an absolute contraindication in certain scenarios, but if there was a reason for pancreatitis and now that's resolved and not existent anymore, again, with your evaluation, a good discussion between you and your physician to figure out the risk and benefits. There are other conditions like proliferative diabetes, diabetic retinopathy, which is retinopathy related to complicated uncontrolled type 2 diabetes. We have studies more specifically for semaglutide, where it's very important to just get a good retinal examination if someone already has complicated diabetes to make sure that they don't have like active bleeding vessels or proliferation going on, as introduction of GLP-1 receptor agonists in these patients with diabetes might just worsen their retinopathy. Then comes if you're using, again, these medications in concert with other medications which can drop blood sugars in patients with diabetes mellitus, then overlapping more medications, of course, will lead to a risk of hypoglycemia, low blood sugar. So that is another, caution and supervision and discussion that is needed, but it's not an absolute contraindication. The first four that I discussed would be the common contraindications that you will see in these list of medications.